So here are three things that your clients want to know before they purchase your medical service. It doesn't matter to me if you're a massage therapist or a chiropractor or anyone. They want to know these three things if they're going to build a relationship with you. So number one, which I think is the most important, is your qualifications and experience. Are you a graduate of a certified program? Are you involved in your local organization? Are you accredited? These are things people want to know. Are you part of the Better Business Bureau, perhaps? Things like that. So hang that up on the wall, have it available on your website. It should be somewhere in your bio. I don't recommend that you need to keep talking about it and talking about it and talking about it, but it should be available and up front and center for anyone who is interested in knowing that. It gives them a sense of security, and it provides them some assurance that you know what you're talking about and that your work is done effectively and safely. Now, what you should be putting on your social media more often than just the first time or just in your bio is any continuing education that you take. Maybe you take some workshops. Maybe you go and get another certificate, or you offer a new service. People want to know that you're continuing to learn, and that you do need to inform people about, because the client who hired you 3 years ago, they may have no idea that now you have new skills and have taken on new things. And if you want them to refer you, they got to know about it. So do start putting that in your social media content strategy. The next thing your client's going to want to know about you before they hire you for your medical services is, do you have any client reviews or testimonials? What are other people saying about you? We know what your school said about you, but we also know there's a big difference between book smarts and the real deal. So I'd like to read some testimonials. How was your bedside manner? Were you caring? Did you put extra care and attention? Or did you just rush me out the door? Or did you not listen? Did you ignore your previous clients? These are the kind of things that a lot of people are going to want to know about. And if I'm new to that town, or maybe I've never heard of you before, or I'm not coming in from a referral, I just Googled you, found you on social media, that can be hard to really assess. And client testimonials are probably the number one way that you can do that. Some of you may be hesitant to put on client testimonials on your social media. I think if it's just a first name and it's a common first name with maybe the first letter of their last name initial, that's fine. Like, for example, a name like Brittany M or Jennifer C or something like that. I think that's totally fine. I would not put their full name unless, if they're going to go on your Facebook and they're going to leave you a review, or they're going to go on Google and leave you a review for your business. That's them opting in and they're deciding to make their information public. They know that's a public forum. But you can take those reviews that they're making and you can create social media posts on them and recycle that through the year. Like, if you have 12 Google reviews for your business, put up one per month. Try to aim for as many as you can and keep putting up that people like you and what people are saying about you. Be proud of that, because that is very effective for potential clients, to help persuade them to use your services. But I also think it's just a matter of pride and work. Like, it shows that you care about your patients and you care about healing. So why wouldn't you want to show that off? Remember, we're trying to get away from selling. We're trying to get more into demonstrating, and this is a really good way to do that. And the number three thing that clients are going to want to hear before, or want to learn about you before they book your services, is that you take a personalized approach to their needs. They are not treated like a number. You don't have your hand on the doorknob while they're coming to see you. Like, they are looking for help. And I think that's very important, that if you are going to a service provider, especially a healthcare provider, for help, that you are heard, that your symptoms are taken in, that your worries are accounted for, that your fears are addressed. That is very important. I don't care if that patient is 5 years old or 50 years old. They all want to be heard. So make sure that you are making that very clear. Now, how do you communicate to people that you do that? Well, that's by emphasizing your commitment to personalized care and effective communication in your marketing. So your social media slides, the things that you're posting, should be making that abundantly clear for people that are considering picking up the phone or booking an appointment with you. And if you have a hard time doing that, please contact me, because I can help you with that. And I sell several social media packs that are designed for that. But if you want to go it on your own, that's completely fine and totally, absolutely doable. You just have to be very clear to your patients that consultation matters and care matters, and that it's part of your commitment and it's a source of pride for you that That is something that is part of your value set. Make that very clear to your clients and they will feel it. And here is one bonus criteria for those who have made it this far in the video, and that is your cleanliness and professionalism. That is really important as well to potential clients. So it's very important that you're clean, obviously, and hygienic. I think it goes without saying, but because it's a professional environment, it's crucial for their comfort and trust. They want to know that you take some measures, like how often is hand washing performed by you and your staff? How often are those linens cleaned? What about those hot stone massage things if you're doing massage? What about how often are those stones cleaned or disinfected in some way? These are things that are important to your clients. It should be important to you too, but I think a lot of people just don't make a point of expressing it. And it does need to be expressed. I would put it in your website. If you have a frequently asked questions section, that is a really good place to put that, or an about section on your website. And then if you're going to put in your social media, every once in a while, sprinkle your content with some slides about that. But when it comes to professionalism that goes beyond hygiene, I think a really important factor in professionalism is your confidentiality. And that is critical in our healthcare role. We don't know why people are coming to us. We don't know who they want to know and who they don't want to know. And it should be presumed that every healthcare worker that you experience as a patient is considerate and is serious about confidentiality. But I don't think patients necessarily presume that that is the case with the receptionist that they walk in and experience and discuss with, or their technician, technologist, therapist, whatever your role is. I don't know that everybody knows that they have that same level of professionalism and confidentiality as you would receive from a doctor. So if that is a commitment that you have to your clients, and I really feel you should, then I would make a point of that and add that to the slides in your social media. Again, if you need help with that, I sell social media packs. I go over these kinds of things and have them written out perfectly. They're customizable and editable for your business. But if you want to do it yourself, totally go for it. Just please do make sure that you go over these points because I think these are things that are on people's minds before they book your services. Thank you.